Good afternoon, everyone. My name is Robert Schwartz. I'm the director of the Osher Center for Integrative Health, and I'm delighted that you're all here. I'm also delighted to welcome our guest speaker, Jeremy Cohen. I'll give a little bit of his background. He has his BS from Tulane University. I won't give the dates. He got his PhD from Tulane as well in cognitive neuroscience, and he did a postdoctoral fellowship at Stanford University at the Center for Interdisciplinary Brain Science Research in the psychiatry department at the School of Medicine. Dr. Cohen's research interests are emotional processing and the neural systems that underlie emotional experience. His research is focused on brain structure and function that relates to anxiety and depression in developmental populations, as well as psychosis in adults. His current research is focused on the interaction of dynamic functional brain networks and systems related to emotion regulation, attention, and health benefits of mindfulness meditation, something that we all should be doing. His neuroscientific understanding of meditation is combined with the informed by nearly 20 years of personal meditation practice himself and numerous different traditions. So, Dr. Cohen, welcome, and it's a pleasure to have you speak to us today.
Yes, thank you so much. Um, a- okay. And so you can see this okay.
Yes.
Okay, wonderful. Yes, thank you to everyone for tuning in today, and special thanks to Bob and Laura for inviting me, and to Emily for helping to organize everything. Um, and I think a great place to start is just taking an opportunity just to arrive in this moment. So perhaps we can engage in a brief meditation, just to help us to arrive in this moment, into our bodies. So if you're comfortable allowing the eyes to gently close, or perhaps directing the gaze on focus to the floor, and just taking in a deep breath and breathing out with another deep breath in and out. One more deep breath in and out, and allowing the breath to return to its natural rhythm, and just reconnecting with the body in this moment, connecting to your chair, aware of its support, and directing your attention down to your feet. I'm just aware of the contact of your feet with the floor. And then attending to the sensations of the feet, exploring, beginning to feel the feet from the inside. Noticing any sensation, temperature, heat, cold, weight, lightness, heaviness, moisture, perspiration, humidity, vibration, pulsation, throbbing, any discomfort, any pleasantness. No special sensations, just whatever's there. And just aware that there's feet. This is the feet. And this is the body. And the body's breathing this entire time. breathing on its own. So you can shift your attention, if it's comfortable to do so, to the entrance of the nostrils and just becoming aware of the flow of respiration. Breath is coming in and going out. If it's more appropriate, you can follow the breath, the rise and fall of the chest or the belly. No need to change the breath in any way, just aware, observing as it is, not as you'd like it to be, not as you think it should be, just as it is. And when you're ready, allowing your eyes to reopen and reconnect to your three-dimensional environment. Excellent. So welcome back to this moment. And in our talk today, we can continue our exploration of some of the neural mechanisms and the benefits of mindfulness meditation that we just experienced. This is a very exciting topic. There's been a lot of literature, certainly a lot of excitement in popular culture over the last 15 years or so. And there's a lot of health benefits that have been associated with meditation as well. So the first thing we want to do is really, talk about what meditation is, in the different forms, and kind of give us a little bit more context of what mindfulness meditation is. Begin to look at that framework and begin to look into the body and what physiological evidence exists to support that framework, explore the research, what sort of changes are happening in the brain resulting from meditation, looking into potential mechanisms of meditation in terms of its effects, as well as sort of zeroing in on a certain part of that through some of my own research and research of others related to the default mode network, and we'll talk more about that. And then we can explore a bit of those health benefits and then discuss a bit about future directions. So some of us may be familiar with meditation, others not as much. There are many different meditative traditions. Popular culture does very well to lump everything together and just call it meditation. And you see articles, does meditation work? And articles like that, it's like saying, is sport fun? There's many different forms of meditation, and they're not all the same. They work on different things. These different practice forms get lumped together in the research literature as well. The literature doesn't even really do a good job of separating sitting-based practices from movement-based practices like yoga and Tai Chi. And of course, yoga is its own, bursting family of different practices as well. So we're going to focus on sitting practices in this talk. And these are typically point of focus based practices. And what's different is, what is the point of focus? So in focused attention, this is just single point of focus practice, where individuals are really just training their attention to a singular object. So at the end there, we were focused on the breath. So a lot of meditative practices will focus on some bodily experience, like the breath as an anchor, as a singular point to focus attention. Of course, it could be an image, it could be a sound, it could be a mental image, it could be an actual three-dimensional image like a candle. And really the purpose of these practices is very much to exercise and train concentration and become so concentrated to essentially become absorbed or unified with the object of focus. Then there are open monitoring approaches. This is really what we'll end up focusing on. This is where the point of focus can change. This is sort of what we experienced just at the beginning, where we spent some time attending to our feet, or attending to the fact that we were sitting, or attending a bit to the experiences of the breath, or perhaps noticing different thoughts that were coming up. All of these different experiences are different objects that we can pay attention to and learn to really embody those different experiences. So this is much more of an embodied practice. There are compassion-based practices. This is oriented towards cultivating kindness and compassion in different forms of meditation here, like metta or tonglen or forgiveness practices. There are the use of different phrases to help sort of orient concentration, but also some attention paid to different sensations in the body. So it's complementary to sort of the open monitoring or the mindfulness meditation, but it is its own type of practice. And then there are mantra-based practices, and these are as they sound. Everything is sort of oriented towards different sounds or phrases as the point of focus, like Kirtan Kriya or Transcendental Meditation, except here, instead of singular absorption, this concentration is to develop a much broader, spacious awareness, and really to have experiences of expanded consciousness. So these can be really varied practices, and they have very different techniques and things that individuals would work with during these periods. And of course, that would relate to different potential benefits, something that unfortunately is, I would say, a bit lacking in the literature to this point. As we consider to then begin, as we begin to consider what mindfulness is, I actually want to orient us back to a central feature of the human experience that can sometimes be devalued or misunderstood in a general sociocultural context. And this is emotion. This is this physiological currency, this physiological language of the body for how we're able to evaluate our inner and outer world. And this will just help to give us a bit of a framework from the Western psychology perspective as we begin to consider the framework that's really offered in mindfulness meditation practice. So the earliest model with this is quite simplistic. This is and straightforward, the James Lange theory. We've got our stimuli in the environment. We've got lions, tigers, and bears, and some physiological response. And oh my. So this is the earliest representation that we have some experiences. It causes some physiological response, a sensation on the body, and we have our subjective emotional experience. Cohen and Bard didn't really like that description, so they came up with their own model, again with those lions, tigers, and bears, but with that subjective experience, oh my, and the physiological response occurring at the same time. So here, I just want us to sort of pause, and if I ask you to honestly examine your own experiences in terms of how those experiences appear, which of these models best represents the appearance of your experiences? And if we are honest, and very similar to the responses that I would get from many of my students, it's really the Cohen and Bard theory that seems to represent the way that our experience appears to us perceptually. However, the empirical evidence supports James Lange that the physiological response, the sensation of the body, is first, and then we have the subjective experience, which says a couple of things. The appearance of our experience is not necessarily what it is, and not too surprisingly, the rate of processing through our nervous system is far faster than our ability to perceive it, which makes sense because all of those actions of the nervous system are indeed leading to our perceptual experience. Later emotional models, the Schachter two-factor theory, Schachter-Singer two-factor theory, combines these together and basically gives us this model that says, yes, there are these sensations of the body, and there's also some mental, there's a cognitive component that can actually influence our subjective experience and our different behaviors. So now this really brings us well into what the framework is of what mindfulness is. It's not a mishmash of different practices. It's something that is very specific. So right now, many of us are sitting, perhaps we're standing. Are you aware that you're sitting or standing? Are you aware still of those contact points with the floor? We practiced with that just a moment ago. Has that slipped away? Did you just adjust your posture? Why? Why would that be necessary? Thich Nhat Hanh suggests that if we're not aware of our neutral sensations, those that are neither pleasant nor unpleasant, they eventually become unpleasant. And then you or I shift our posture in order to try to control that discomfort, to try to change it in some way. So it turns out that while lions, tigers, and bears are a great example for the James Lang theory and other emotional theories, we have these physiological responses in the body that are happening all the time. And some of them are unpleasant, some of them are pleasant, and some of them are neutral. And we're constantly generating these different responses to them, largely without a lot of our active awareness. And this is where mindfulness comes into play, because we're bringing our full awareness to these different experiences. And mindfulness is really based on a very specific set of instructions that was laid out by the Buddha that is very reminiscent of those emotion models that we actually just looked at. Of course, it dissects things a little bit further to look at a little bit more detail of our experience. So before, we sort of had sensations of the body and experiences in the mind. The Buddha suggests in these 4 foundations of mindfulness that really instruct this practice, one of the major foundations is the body itself. The first thing we need to do is be aware that there is a body, that it's standing, that it's sitting, that it's lying down, that it's walking. So all of the different postures and actions of the body are things that we can be actively aware of. And importantly, according to these instructions, is a very valuable thing for us to be aware of as we begin to embody our experience in the world. Similarly, there are those sensations of the body. So we can begin to be aware of those sensations that are arising and passing and changing in response to those different experiences in the outside world, on the inside world. And these different experiences are indeed pleasant, unpleasant, and neutral, and we can begin to become aware of those. Similarly, there is a foundation for us to be aware of the mind or our mental states. So any of our thoughts or beliefs or images or affective states like anger and frustration and disappointment and excitement and joy and happiness, all of these different experiences are different mental states, and we can begin to become aware of those. Again, these instructions break things down a little bit further and includes this 4th foundation, which is the objects of mind, which are all of the percepts that make up our mental state experiences. So earlier, as we were meditating and we spent some time focusing on our feet were the object of mind. And sensation within the feet, the sensations become the object of mind. Or the breath was the object of mind, or just noticing that we were sitting could become an object of mind. So all of the different experiences and information that's contributing to our mental states are these different objects of mind. It's certainly a very advanced aspect of the practice. So without getting necessarily overwhelmed, hopefully, with those different key foundations, we really want to ask ourselves, what are we really working with? What skills are we developing as we work in this practice? And the first thing is we need focused attention. And I sort of alluded to that earlier, that while focused attention meditations can be separate unto themselves, it is still a component of the other forms, just in different ways. In this practice, we begin to focus our attention onto some object or another. Could be the breath, could be our feet, could be our hands, could be some sensation in my knee. It can be anything. So we just have to become aware, and even becoming aware when we're not aware. So it's a very cyclical process. And we begin to develop this observational spirit and relationship with our experience, to have and develop a very impersonal experience and impersonal, and really observe the impersonal nature of the arising and passing phenomena. And we bring a lot of curiosity to these different experiences as they're arising, as they're passing, just to observe and explore and investigate the different aspects of those experiences and what's happening, and noticing that those different experiences are changing. Of course, this requires us to bring a good bit of patience as we allow different experiences to be there, as we allow for moments when we want there to be experiences, but those experiences aren't there. And we're very patient with what is, and allowing it to change in its own natural course. And of course, we'll come across difficulty, and we have to be kind. We have to be kind with the pleasant sensations and experiences as they fade away. We have to be kind with the unpleasant experiences as they linger for whatever period of time and as they fade away. So developing kindness and persistence is another aspect of this practice. This consistent reminder to ourselves, this is it. This is the body. This is the experience in the body. This is the experience in the mind right now, in this moment. And sometimes simply remembering to bring awareness back to this moment and beginning again. Because this is, again, it's a cyclical process. We'll have periods of awareness, we'll have periods where we're not aware. And then we become aware that we're not aware, and we bring awareness back. And it is this evolving practice, again, this embodied practice that we are working with. And we develop acceptance as well, and this openness for all of these different experiences, to be able to be with these different experiences and observe these different experiences. And in this way, we begin to learn not to just react in whatever conditioned patterns that we have learned to just react to these different experiences. So we actually begin to break these habit patterns of reacting to the pleasant experiences with clinging or craving, or reacting to the unpleasant experiences with avoidance or anger, or wanting to push it away. And all of this is very much reminiscent of that James Lang theory that we talked about before. And in this way, working with these different skills, we're reconditioning the brain and the nervous system towards these responses to our experiences, instead of those old conditioned habit patterns. And we develop a new relationship to these experiences that are arising in the body, that are arising in the mind, and we learn to view these experiences objectively, less self-identified, less personally, with a more holistic, integrated understanding of our experience. So instead of lions, tigers, and bears, oh my, it's wow, lions, tigers, and bears, what incredibly majestic creatures, and let's get the heck out of here. So it's not, it's not some naivete. It is really the entirety of our experience is what we're attending to and becoming aware of. So it's important to point out what mindfulness meditation is not. It's not about achieving specific states like calm or peace or tranquility. Those things happen, but that's not the goal. So we're not valuing some experiences over others. And this is an important part of acceptance. This is the experience in the body in this moment right now. It's not about having a clear mind. The mind produces thoughts the way the mouth produces saliva. It just does it. And when we begin this practice, and throughout the practice, we turn our attention to the body, to the sensations, to the breath. And sometimes the brain throws up a temper tantrum and all kinds of thoughts start getting tossed about. It's one of the 5 main obstacles that the Buddha indicated is agitation, which is a very common thing for meditators to experience. It's reminiscent of one of my own experiences, many of my own experiences, but one in particular for my first 3-day overnight retreat. Where there were so many thoughts and frustration and self-judgment and self-doubt, and everybody seemed like they were having a much easier time than I was. And it was before the pandemic, so I had a roommate, and I was utterly convinced that he was totally annoyed by my presence. And, we got to the end and we were able to talk, and we expressed a lot of gratitude for each other and being able to share the experience with one another. And in the course of that conversation, he revealed that he had his own thoughts, that I was annoyed by his presence. And it was in that moment that it became abundantly clear, not only is my brain just creating all kinds of stories, it's doing it in a way that's playing tricks on me. And this is just what the mind does. And when we work in this practice, we begin to see these patterns, and we can learn to laugh at some of these different occurrences. And, I mentioned before about this changing nature of our experiences. And we're all cognitively aware that things change. But this practice really emphasizes a deeper understanding of that change through the observation of our direct experiences within the body, within our own body. So it is our practice within our own body. It's not out there necessarily in the world, although there is a part to that. It comes from our own body. So as a neuroscientist, I want to look at, do we have evidence in the body of this arising and passing nature that seems to be described by this practice? Of course, I look at the nervous system, and we can look no further than an action potential, where there's a rising phase and a falling phase and coming back to rest. So we have a rising and passing. If we look at multiple action potentials, it's nothing but arising and passing. If we look at the synapse, we can look at the influx of calcium and the release of neurotransmitters and the binding of those neurotransmitters and the clearing of those neurotransmitters, and then the postsynaptic potentials that result from that binding. And it's nothing but an endless string of arising and passing and arising and passing. All of these action potentials, all of these signals throughout the brain, the nervous system, throughout the entire body. This is what's contributing to all of our experience. So our experience then, at its fundamental level, is founded on this impermanent characteristic, this changing characteristics, what allows our bodies to have the experiences that we do. Of course, this constancy of change also yields a certain underlying unsatisfactoriness to our experiences. No matter how pleasant the experience, it doesn't last. And no matter how weakly unpleasant or how strongly unpleasant our experiences are, that change can't come fast enough. So there's this stickiness, and that stickiness is potentially linked to this attachment to this self-identity that so desperately wants to feel good and so desperately does not want to feel bad. And just even thinking about it like that has really profound implications when we start thinking about aspects of mental health. So we've got evidence of arising and passing in the body, in our physiology, and we know that this is there. Are there effects that we can see on the nervous system as a result of meditation? There's a fair amount of literature out there, so we're not going to go through all of it. But here's one review study that really helps to highlight a lot of the common anatomical changes that we see in gray matter density, in cortical thickness, in areas of the brain related to interoceptive and exteroceptive bodily awareness, memory function, emotion regulation. Again, hinting at things that we've already discussed, other things that we'd kind of like to enhance about our own experiences, and we'll talk about those in relation to some of the health effects. It's not just gray matter that's impacted by meditation. White matter is impacted as well. And you can see here in a short-term study with just 10 sessions of guided meditation, accounting for about just shy of 12 hours, and whatever practice these individuals did on their own, we were able to see, or it was shown, this is my group, but from Sharp, we can see that, you know, there's a significant set of changes in white matter connectivity, in a shift between some of the inter and intra-hemispheric connections, particularly between the two bilateral insula cortices. And insula has a very prominent role in salience, seems important for mindfulness, and also the left insula being now recruited in is involved in parasympathetic autonomic regulation, also seemingly related to some of the significant health effects. For any of us with us who are interested in aging well, there's this measure of brain age that computes the difference between someone's chronological age and an algorithmically computed age based on their brain morphometry. And it was shown that experienced meditators had brains that were 7.5 years younger on average than their chronological age. And the biggest gains were coming after the age of 50. So it's never too late to start. And if you're not sold quite there, brain age is a quite robust measure. It was used to predict at a 90% accuracy rate patients with mild cognitive impairment who would then go on to develop Alzheimer's disease. So this is indeed a robust measure and really has a strong implication for some of the aging neuroprotective effects of meditation. So we can see a lot of brain changes, but is there any sort of mechanism that's beginning to evolve here? We maybe need to look a little bit more at the functional state of the brain in meditation. And again, lots of literature, but if we look here across those different key types that we started with, you can see all of these different forms of meditation impact brain function, and they do it a little bit differently. So that's really important for us to begin to look at these different practices as unique practices. But the thing that stands out are those blue circles. The most expansive set of effects seem to come from mindfulness practices. And you can see the insula cortices, so salience, frontal cortices, so task orientation, and also those down arrows in the location of the medial prefrontal cortex and the posterior cingulate cortex, which are regions of the default mode network. So there seems to be this down regulation of the default mode network. Well, what is the default mode network? I mentioned this tricky, sticky spot earlier about the self-identity and all of my unhelpful self-judgmental thoughts during my retreat is a lot of what we can associate with the default mode network. It tends to be activated when individuals are focused on their internal mental state experiences, self-referential processing, interoception, autobiographical memory retrieval, imagining ourselves in the future. And of course, any of those sound like functions that can and are, in their own way, beneficial. However, overrepresentation of those different functional states can be problematic. And we see atypical organization, functional connectivity, or connectivity with other brain networks associated with the default mode network in depression, anxiety, PTSD, chronic pain, mild cognitive impairment, Alzheimer's disease, amongst many others. So this is a very important system for our overall health and functioning. So I was able to do a little bit of work in the area of the default mode network by way of the Nathan Klein Institute Rockland sample, an open source data set, which I'm not going to go into all about it, but has a whole rich slew of information, genetic information, all of the brain imaging, neurocognitive measures and physiological measures, behavioral measures, psychiatric measures. But most exciting to us was a task that was a real-time fMRI neurofeedback task, where they were feeding brain activity from individuals' default mode network areas and showing that back on the screen as these little odometer, speedometer needles, and telling them to either focus and downregulate the default mode network or wander, upregulate it. We were interested solely in the downregulation state, because that's more helpful. And what was really interesting is they slipped in this one other interesting question, seemingly just for us, about, on a scale from 1 to 10, how would the individual rate their meditation experience? As you can see, not many people rated their meditation experience particularly highly. However, despite that skew, the more meditation experience they reported, the better they were able to downregulate their default mode network on command. And when we looked at the resting state brain data from the same subjects, we were able to see at baseline, essentially, we have a strengthening of connectivity between the frontal eye field in the right hemisphere with lateral prefrontal cortex and right posterior parietal cortex. So at baseline, there seems to be this heightened level of connectivity between dorsal attention areas and areas that are focused on task orientation, so task engagement. So a little bit of a brain that's a little bit more heightened at the ready. So very interesting. If we kind of dig back into the literature, I think one of the most exciting studies that was really done with regards to meditation was very clever in 2012 by Hassenkamp et al., where they had meditators in the fMRI with just a 20-minute meditation, simple breath focus, pay attention to the breath, and one simple instruction: when you're aware that the mind is wandering, press this button. And when they did that, the researchers were able to create these 4 artificial conditions to sort of look at what was happening in the brain. And they basically said, before the person pressed the button, their mind was wandering. When they pressed the button, the person was aware that their mind was wandering. Right after they pressed the button, this shifting attention. They were shifting their attention back to the breath. And then slightly after that, they were back focused on the breath. And when they analyze the brain data, it's actually pretty much what you'd expect. The mind wandering period engaged a lot of default mode network. The awareness of mind wandering period engaged the salience network with a lot of activity in insular cortex. And the shifting of attention and the sustained attention phases of meditation were indeed engaging that dorsal attention and task orientation networks. Very similar to actually what we saw from the resting state data that my group had been looking at, that was suggesting that at baseline, we're kind of seeing that during meditation. So similar to exercise, We're exercising certain muscles, and we're strengthening those muscles to then be ready to go out into the world and do whatever activity is necessary. More recently, mindfulness meditation has been examined again, looking at a larger impact of how these different networks are engaging with one another. And we do see this shift across all of these three major networks in the brain. We see within the default mode network, there's sort of a decoupling of a lot of the internally focused I, me, my parts of the default mode network, and more the sensory awareness parts of the default mode network, both sensory awareness within the body, sensory awareness in the environment, that is now more tightly linked to the salience network. So there's greater importance to this sensory information, and all of that is engaging with different attention and task-oriented regions as well. So we have a brain, again, that is more at the ready, more engaged, and more present in the moment to act and do whatever that particular task is necessary. So that's a pretty quick rundown of some of the fascinating literature that's currently out there with regards to meditation. So what are the benefits of meditation? Well, I'm happy to report that there are many different benefits to meditation that would probably excite a lot of us, both individually or perhaps as practitioners. We don't really have time to go through all of these in heightened detail, but I'll highlight a few. Of course, improved attention is a common feature that we see really across different meditation types. And here we have some different studies and replicated studies using just Stroop word color tasks, where meditators are performing better than controls. Their brains are actually more active during the congruent trials, so they're more engaged, and they're actually less active during the incongruent trials compared to controls. And they're at the same time, they're more accurate, they make fewer mistakes. Work smarter, not harder. And that's what the meditating brain really helps to instill. And it's not just in that one type of task. You can see on the right, this is now a dichotic listening task. And again, it's the same thing: improved reaction times, improved accuracy, more correct answers, fewer mistakes. And this is really what we're seeing across these different studies. There's improved cognition. And like I said earlier, it's never too late to begin. This is just one study from individuals with mild cognitive impairment. And just with 8 weeks of MBSR training, they actually improved their Montreal cognitive assessment scores. So this can be beneficial at any stage of our development. Another important aspect of our experience that all of us want less of is stress. And we know how devastating that can be for us. So here we've got an assortment of different studies, again, in just short-term practice of MBSR training. This was cancer patients, increased natural killer and B cells, increased quality of life, decreased systolic blood pressure, decreased heart rate. There was decreases in cortisol levels as well. And all of those different measures continued to decline in the 1 year following the training. And that decline was most robust the more the individuals continued to practice. So it is a practice. This is something that we continue to work with. We don't just go to the gym once and then, we can be an Olympic athlete. We have to go to the gym. We have to exercise consistently. So it is a consistent practice. And if that's not enough, genetic effects. This type of training actually can increase telomere length. And we know how much, again, that is important for healthy aging as well. More physiological evidence. We see increases in low-frequency heart rate variability. You can see on the right during meditation. That's completely absent when someone's just sitting quietly, as you can see on the left. So, and that low frequency heart rate variability has specifically been linked to left insular activation, which we mentioned that before in some of the structural changes that are happening. And other studies have actually linked a lot of these rhythms together, and that there's this coherence between brain, cardiovascular, and respiratory rhythms during meditation. So it is a holistic practice. It is a practice of integrating the bodily experience. There's other studies that show reductions in pain, in chronic pain, reductions in spasticity following stroke. Of course, there's improvements in mental health as well. Decreases in social anxiety, decreases in depression, decreases in rumination scores, increases in self-esteem, reduced reactivity to negative beliefs. How helpful would that have been on that first meditation retreat? Of course, those were benefits. I was able to experience the fruits of that experience, of going through that experience and really seeing that. And throughout the practice, considerably less reactive to negative thoughts. So where is it that we go from here? To me, mindfulness is an integrated practice. It's really a practice of being human, learning to be more deeply engaged and in harmony with our inner experiences in this moment, to be present and engaged with others with an appreciation for their experiences. In this way, the practice doesn't just foster a deeper understanding of our nature, which it certainly does, and I explained some of that. It also helps us to cultivate an attitude of gratitude and generosity, embodying a much more caring and compassionate attitude towards the inner and outer world, the inner and outer experiences of other people. When we look at this practice from that point of view, first of all, this seems like an incredibly valuable tool for any health practitioner to have in their own tool bag for their own self-care. It's also a tool that seems perfectly oriented and right at home in an integrative health clinic. It's very much an experiential practice on top of all this. I very much enjoy these talks, and I hope that you value this talk and other talks like this to help us to understand the practice and to become inspired by the practice. At the same time, it is a practice that needs to be experienced directly through each of your own bodies. That's where the understanding and the comfort really comes from, to seeing our experience as it really is, not as we would like it to be, but as it actually is in this moment. So imagine with that tool on board, going into your next exam room with this open exploration of your own state, of whatever it happens to be in that moment, and taking that openness and curiosity with you into that room, and carrying that openness to really hear what our patients have to say, and having curiosity about their experiences, and being able to connect different dots. This helps with creativity as well, and problem solving. It's a much more engaged environment. And of course, not just helping us provide better care, we'll want to offer this to our patients. In order to do that, and really to understand the practice, one has to give it a try, has to actually see what the experience is like, so that we have an understanding of what it is that we're offering to patients. On top of that, if we do have a clinic where we have some nurses, where we have some doctors that have their own practices going, these patients are coming into an environment of curiosity, of a different feeling. And they actually see practitioners. They see some of the benefit. And actually, they might be thinking to themselves, that looks good. I'll take some of that. And then when we suggest it to them, it's a lot easier for them to be curious to give it a try themselves. And I very much value and appreciate all of your kind attention. And with that, I'll turn over the final few minutes for any questions that may have arisen.
Thank you very much, Jeremy. That was a great lecture. I really appreciate the fact that we can demonstrate some real science behind the act of meditation. I think for many of us in the medical profession who grew up in a certain environment where it was important to demonstrate evidence, especially in the softer areas that we focus on. This is, I think, extremely helpful.
Yeah.
Laura, do you want to monitor any questions?
Yeah, I put in the chat that if anybody has any questions, feel free to write them in the chat and we can read them aloud so that Dr. Cohen can answer them, or just raise your hand and we can call on you. So feel free. Let's see, are there any, I don't see any questions at this point.
Okay.
I think your talk was so incredibly clear that
I'll jump in here. So thank you very much, Jeremy, for the presentation. It was a great overview. You know, there's so much that we need to learn, and also how to effectively bring this to and scale it, right, to you know, to a variety of population groups, including healthcare providers themselves. You know, I think one of the very interesting questions out there that I think is still being worked on is what is the minimally effective dose for you know, for getting a therapy, you know, we'll just use the language of medicine, right? For to obtain a therapeutic benefit, right?
Right.
And I think that this is a really critical question for healthcare providers, because, you know, we know from the literature just you know, just the levels of stress and burnout that the profession's been experiencing. When we just went through COVID, which was just you know, historic in terms of its impacts.
Yeah.
And, you know, I've done a little bit of work here with healthcare providers here at University of Miami, and you know, they're such a time-stressed group. You know, that was one of the takeaways that we learned in trying to bring you know, some modified MBSR training.
Right.
And you know, I think we really have to step back and think creatively about you know, how to best engage and you know, document you know, that for time pressured in professionals, you know, this kind of an investment is really essential on multiple levels. And you know, you know, one thing that sort of intrigued me in terms of a typical day in a healthcare provider, you know, one thing that they may do on multiple occasions every day is go through their mandatory hand washing between clinical encounters.
Oh yeah.
Which is a critical, you know, critical for infection control purposes, but perhaps an opportunity for training, very focused training on, okay, take this time. You know, we really need to come up with, you know, creative strategies to test, to bring this to, and you know, in this case, to healthcare providers.
Yeah, no, it's a wonderfully, you know, framed question. And you know, of course, my brain is going into all different directions with it.
Mhm.
Absolutely. all moments are moments of potential mindfulness,
Right.
because, you know, being aware of the body, the actions of the body. So absolutely the washing of the hands, being very mindful in those moments, just mindful with a few mindful steps walking into the room. You know, I think, you know, kind of zooming out and thinking about that larger picture, you know, to put it in sort of the administrative context, there's investments, and then there are the rewards, you know, the outcomes from those investments. So investing in some of these strategies and investing some time and some space for it will see dividends, and patience is part of that. As far as how much practice is necessary, we saw a number of those studies where it's short-term practice. The courses are 8 weeks. Does that mean that it has to be 8 weeks? Not necessarily. The big thing in terms of the impact for an individual is going to be consistency. And that doesn't mean that a person has to meditate 2 hours a day or an hour a day. They can meditate 5 minutes a day. They can meditate, you know, 5 minutes in the morning and 5 minutes in the evening, as just a time to formally sit down and kind of just settle and work with some of these skills. It's sort of the same thing. How much exercise is necessary? How much time at the gym do I have to spend each week? It's not millions of hours, right? It's not all of the hours of the week. It's some of them. So, and it's a certain degree of consistency. So the sitting practice is necessary, because we do need to really be able to focus in on working with those skills. And then absolutely, we want to use them as much as possible. So in the clinic, and just training that around the hand washing and some different experiences that we're all doing repetitively, instead of doing them repetitively, those can become incredible invitations to work mindfully. And that is going to be the biggest catapult, because the individual is really focusing on continuing those skills throughout the day. It's not just the sitting. So then if the sitting is 5 minutes or 20 minutes, that consistency throughout the day makes that 5 minutes so much more powerful.
So I want to add my 2 cents from a clinical perspective, that the practice makes perfect, in the sense that the more you meditate, the greater the power that you have in your ability to manage yourself. And as a physician, I have found it extraordinarily useful in terms of creating a sense of calm in the process of interacting with patients. And it's very perceptible. Patients will walk in stressed, and if they meet with a provider who has a background in meditation, they will walk out of that consultation room much less stressed. So it's just an enormously powerful tool. And although we've run out of time, I want to thank Jeremy. We're going to invite you back and again in the future, and to thank everybody for participating today.
Bye, everyone.
Thanks so much. If there are additional questions, feel free to email me at any time.
Really appreciate it so much.
Thank you.
Be well, everyone.